life. I am a 2-time liver transplant recipient, and if it wasn't for medical advancements and these kinds of research, I wouldn't be alive today.
Well, liver transplantation has come a long way and has revolutionized the treatment of liver disease and can give somebody who is doomed to die a new life. But there's still a lot of things that are not resolved completely. We still have not enough organs, at least not at the right time, and we still need immunosuppression to prevent rejection after the transplant, and on the long run that can have side effects like infections or cancer. So there's still a lot to do.
So we spent about, I think it was 6 days in hospital, undergoing every possible test you could think of: blood work, x-rays, MRIs, heart tests, eye tests, like everything, to see if she was suitable. And the doctors decided that yes, she was a candidate, and they put her on the list for liver transplant. Right.
Yeah.
Say liver transplant, 5 months old. Can you say that for Mommy?
No.
On my first day of the 2-day assessment is when I met with the surgeon, and he said, look, you're almost an adult. I'm not going to sugarcoat anything. I'm going to be very real with you. You have 6 months to live if you don't get a transplant. You don't have time to wait for a deceased donor. You have to find a live donor.
November 4th, 2009 diagnosis. Within 5 to 6 months we heard the news. It was a day I'll never forget. It was May 12th, 2010. Dr. Grant walked in and basically said to my son, young man, you're very ill and I'm not going to hold any punches. You have 5 to 6 months to find a new liver or you will not survive. With better research, perhaps Matthew might not have needed a second transplant. You know, as a parent, having him to face his mortality for a second time, it's a pretty scary thought. So, but I know that he is here today based on the money that's been given and the research has been done today that has enabled him to be sitting beside me here today.
One of the issues in transplantation is managing the potential complications afterwards. I believe that as the research evolves, our management post-transplant will improve. I believe that advances in anti-rejection therapies will improve, and I believe that Kyla's life may have been longer.